News release. Monday, February 27, 202-3. National Institute of Health grantees report results of first multi-site randomized trial comparing the two diets. Eliminating animal milk alone from the diet of adults with eosinophilic esophagitis, or EoE, is as effective at treating the disease as eliminating animal milk plus 5 other common foods, a clinical trial funded by the National Institutes of Health has found. For people with EoE whose disease remains active after they forego animal milk, a more restrictive diet may help them achieve remission, according to the researchers. These findings were published today in the journal The Lancet Gastroenterology and Hepatology. Diet-based therapy for eosinophilic esophagitis will be much easier to follow for many people if it involves cutting just one food from the diet rather than 6, said Hua Kinklos, MD, acting director of the National Institute of Allergy and Infectious Diseases and IAID, part of National Institute of Health. EoE is a chronic disease characterized by an overabundance of white blood cells called eosinophils in the esophagus. Allergic inflammation due to food drives the disease by damaging the esophagus and preventing it from working properly. For people with EoE, swallowing even small amounts of food can be a painful and stressful choking experience. About 160,000 people in the United States are living with EoE. Excluding certain foods from the diet has been a cornerstone of EoE treatment. During the early 2000s, researchers found that eliminating 6 common food triggers of esophageal injury, milk, egg, wheat, soy, fish, and nuts substantially reduced signs and symptoms of EoE. The 6-food elimination diet 6F ED became a common approach to managing the disease. In recent years, scientists have conducted small, non-randomized studies of removing 1 to 4 of the most common food antigens from the diet to treat EoE, with some success. However, the relative risks and benefits of eliminating many foods versus a few foods at the start of diet-based therapy remained unclear. The new findings come from the first multi-site randomized trial comparing the 6F ED with a 1-food elimination diet 1F ED in adults with EoE. The trial was co-funded by NIAID, the National Center for Advancing Translational Sciences, and the National Institute of Diabetes and Digestive and Kidney Diseases, all part of National Institute of Health. Markey, Rothenberg, MD, Ph.D., the senior author of the published study, is director of both the Division of Allergy and Immunology and the Cincinnati Center for Eosinophilic Disorders at Cincinnati Children's. The trial involved 129 adults ages 18 to 60 years with a confirmed EoE diagnosis, active EoE symptoms, and a high number of eosinophils in esophageal tissue. Volunteers enrolled in the trial at one of 10 U.S. medical centers that participate in the Consortium of Eosinophilic Gastrointestinal Disease Researchers, part of the National Institute of Health-funded Rare Diseases Clinical Research Network. Participants were assigned at random to either the 1F ED, which eliminated only animal milk from the diet, or the 6F ED. They followed their assigned diet for 6 weeks, then underwent an upper endoscopy exam and an esophageal tissue biopsy. If the number of eosinophils in the tissue indicated that EoE was in remission, the participant exited the study. If EoE was not in remission, people who had been on 1F ED could advance to 6F ED, and people who had been on 6F ED could take topical swallowed steroids both for 6 weeks, followed by a repeat exam with tissue biopsy. The investigators found that 34% of participants on 6F ED and 40% of participants on 1F ED achieved remission after 6 weeks of diet therapy, a difference that was not statistically significant. The two diets also had a similar impact across several other measures, including reduction in EOE symptoms and effect on quality of life. Thus, 1-FED and 6-FED were equally effective at treating EOE, an unexpected finding. The researchers also discovered that nearly half of people who did not respond to 1-FED attained remission after treatment with the more restrictive 6-FED, while more than 80% of the non-responders to 6-FED achieved remission with oral steroids. Taken together, the investigators conclude that 1-FED is a reasonable first-line diet therapy option in adults with the EOE, and that effective therapies are available for people who do not achieve remission after 1-FED or 6-FED. NIAID conducts and supports research at National Institute of Health throughout the United States and worldwide to study the causes of infectious and immune-mediated diseases and to develop better means of preventing, diagnosing, and treating these illnesses. News releases, fact sheets, and other NIAID-related materials are available on the NIAID website. About the National Institutes of Health. National Institute of Health. National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nagov. National Institute of Health Turning Discovery into Health Registered. Kale Kluwer et al. One Food versus 6 Food Elimination Diet Therapy for the Treatment of Eosinophilic Esophagitis, a multicenter, randomized, open-label trial. The Lancet Gastroenterology and Hepatology DOI 10.1016/S2468-1250 312 312-2 202 3